Welcome, everyone. Thank you for joining Continuous Learning with Bioguard. It is my pleasure to introduce our webinar speaker, Dr. Sadotra. Dr. Susan obtained his PhD from Sinica, Taiwan. He has expertise in biomarker discovery and protein structural biology, with a strong research background in investigating potential biomarkers for target diseases. Currently, Dr. Susan works as a diagnostic product specialist with Bioguard Corporation, Taiwan. Diarrhea is usually a symptom of an infection in the intestinal tract, which can be caused by various bacteria, viral, and parasitic organisms. Infection is spread through contaminated food or drinking water, or from animal to animals. In this lecture, we'll explore the causative pathogens, diagnosis, and treatment solution for some infectious diarrhea diseases. Without further ado, let's welcome Dr. Susan.
Thank you, Dr. Robert, for your polite introduction. And hello, everyone. My name is Sushant, and today we are going to talk about infectious diarrhea in dogs, basically. So I'll share my screen first. Yeah. So yeah, let's start. So my top topic would be how to deal with infectious diarrhea, and particularly in dogs. So before that, we go into details about infectious diseases. Let's first understand about the stool. We may feel that it's a little bit gross, but I think it's very important to know the characteristics of the stool before we jump into understanding the diarrheal behavior in dog. So stool, basically, you can see that once sometime if the stool is not formed or fully formed, basically if it's runny, loose, or watery, that's the sign of diarrhea in animals and basically in dogs. So there is a chart usually vets are following to understand the characteristics of stools based on the color of the stool, as well as the thickness or the looseness of the stool. So on that basis, we can see whether the dog is having some issues inside his gastrointestinal body. So yeah. So, and also to understand the digestive system of the dog is that, you know, that the anatomy of the digestive system of dogs and the humans is a little bit different in a way that they have a specific jaw shape, and as well as salivary enzymes that are designed to kill a lot of, bacteria and other pathogens in the food that they are consuming, as well as the stomach acids that are there present in the dogs are basically 3 times stronger than humans. So that allows dog to digest a lot of complex food, even the raw meat that they are consuming sometimes. And also to understand that when the dog is having his first meal, it takes around 10 hours for him to digest it and also to remove it from the body as feces. So you can imagine that once in this duration, if there is some abnormality is happening in the dog, which is one of the signs that there is some issues in the gastrointestinal system, as well as if the characteristics of the stools are not normal based on the basic charts or the criteria that we saw before, then that's a sign that the dog is facing some problem related to its digestive system, which can lead to diarrhea at the end. So yeah, this is the basic thing that a pet owner should know once he feel that there is some problem in his pet, so that they can go to seek the help of the veterinarian at that time. So going further into diarrheal canine diarrhea, this can cause due to many different reasons. For example, it can be because of dietary issues, such as once you change the diet from one brand to another, or food intolerance, or some kind of allergies that is with the dog. So these are some of the reasons that can initiate a short duration or acute diarrhea in the dog. Other than that, that dogs have a habit of smelling and try to eat some of the things that they are encountering while walking or going to the park or outside home or even inside home. They have a habit of scratching the things or indoor plants they like to play with. So sometimes there are some poisonous substances that the dog may swallow, or a foreign object that can also lead to diarrhea for a small duration. Other than that, if a dog has some kind of other diseases such as kidney, liver diseases, or inflammatory bowel diseases, or certain kind of cancers, that can also lead to diarrhea in dogs. Other than that, once there are some diseases when you are on antibiotics. Antibiotics, of course, kill the inside microbiota of the organisms, which can lead to the diarrhea in dogs as well. Yeah. And last but not the least, I think the stress and emotional upset can also initiate the short duration of diarrhea in dogs. However, in today's talk, we will be focusing on the diarrhea which is caused by infection of certain kind of parasites, viruses, and bacteria. So talking about parasites, it can be protozoa, fungi, and other kind of parasites such as roundworms, hookworms, whiteworms, and Giardia are seen the most prevalent parasite that are affecting dogs a lot. Now, other than that, there are some viruses in the environment, such as parvovirus, dispenser virus, or canine coronavirus that can also cause diarrheal infection in dogs. Last but not the least, bacterial infection, of course, is also one of the major cause of bacterial diarrhea in dogs, such as from Salmonella. So today we saw that most of the pathogens that are causing diarrhea are actually prevalent throughout the world. For example, for the parvovirus, canine parvovirus or Giardia has been seen one of the most prevalent infectious diarrhea issues throughout the world. So today we will know more about parvovirus as well as Giardia, how they enter into dog and how they cause the problems in the dog because of their so much prevalence in the environment, and their survival rate is very high. That's why the frequency of the dog getting diarrhea from these pathogens is quite high. So let's first talk about or go into detail about canine parvovirus. So canine parvovirus basically is known to originate from feline parvovirus. So once in late 1990s, when it was first discovered in feline, by the course of time, it is seen that the virus has mutations that led to the formation of canine parvovirus type 2 as a variant. So this virus is a single-stranded DNA, and the envelope is it's a non-envelope virus, which makes its anatomy very simple as well as more penetrating into the cells and the body. And also, it is seen that in dogs, there are some variants that are present in the environment, such as CPV2A, which is the main cause of acute enteritis in dogs. Other than that, there are CPV2B, which also largely attribute towards the infectious diarrhea in dogs. But very few infections have been seen from CPV2C. However, it's still there in the environment and can be detected in some cases. When we talk about the pathophysiology of parvovirus, it's that it can survive in environment if it's not properly eradicated, and it can be there for years. Other than that, which makes poor immunized dogs more vulnerable for the infection of parvovirus getting from the environment, especially in young dogs within the birth of 6 weeks to 6 months, and also who are not yet vaccinated are more, prone to get the infection of parvovirus from the environment. When we talk about the breeds that are, there are some specific breeds that have been seen that mostly get affected by parvovirus often, such as Rottweilers and American Pit Bulls and English Spencer Spaniels and German Shepherds as well. So seeing the prevalence of this virus and the survival rate, the transmission of virus is also very easy to enter into dog's body. And it's basically have seen that it enters through the oral routes. So basically when dog is in outdoor or even indoor, if the area is, did not properly disinfected, so the virus can enter into dog through its oral cavity, and then it start dividing into the body, and then after a few days it can be shedded through the feces. However, once its diagnostics is done correctly and the treatment is started at the right time, there is a very much positivity that the dog will survive without any issues. However, it can be fatal as well. So getting into details about the infectious stages about the parvovirus. So after the dog is exposed to parvovirus, there is an incubation period of 3 to 7 days before you can see the first symptom is appearing onto the dog. So inside the dog, CPV actually needs, some of the dividing side, you can say like stem cells to actually get the nutrients and energy from them, and also to start dividing by himself. So that's why it's first attack tonsils or the lymph nodes when it enters into the body. And then through there, by the duration of the time, the virus attack the tonsil cells or the lymphocytes, which are kind of the white blood cells, and start replicating in that. And these virus copies then, hit right inside the lymphocytes and being circulating throughout the dog's body by the bloodstream. And once it's inside the bloodstream, the virus have a tendency to start attacking other dividing cells, such as in the bone marrow and in the cell that line the cell wall of the small intestines. So that's how the virus is attacking mostly the rapidly dividing cells, which makes it very difficult for the dog to eradicate the virus from the newly formed cells. So as I say that in the small intestines, when the virus is affecting the epithelial cells, or basically to be precise, is crypt epithelial cell, which are the cells, newly formed cells that helps to regain the villi or the hairs in the hair-like structures in the small intestine. So that's why once the virus is attacking the crypt area of the epithelial cells, it's very hard for the intestines to get get fine after they get infected by the virus. So that's the reason that it leads to diarrheal infection at that time. So basically, the massive lysis and necrosis happens inside the villi of the intestines, which makes the absorption of the nutrients very difficult. And that's why also the second thing is that the cell turnover is not going on at the right number. So that led to the result into the onset of diarrhea inside dogs, which leads to different kind of symptoms, such as starting with the vomiting, or if you talk about the diarrhea, it can be bloody diarrhea, mucus, the diarrhea which has a lot of mucus, or hemorrhages, enteritis as well. Other secondary symptoms that you can also observe could be fever, lethargy, and the dehydration particularly, because you can see that the continuous diarrheal signs and the less absorption of the food and water through the small intestine lead to the condition of dehydration, which can be very fatal in the long term if the dog doesn't get treated at the right time. So CPV diagnostics is very important. However, to get a correct diagnosis, there are many different ways which vets are usually preferring these days. For example, hematology analysis is the first step where you can check the CPV count, the blood count of different blood cells, because as we see that the virus is prone to attack white blood cells. So the change in number of different kind of white blood cells is very often. Other than that, if you see a sign of anemia in the gastrointestinal, that also lead to blood loss, which also can be an indication of a parvovirus infection in dogs. Then it comes to the biochemistry analysis. As we saw that the dehydration is one of the cause of the parvovirus infection. So there is a very obvious that there will be an electrolyte abnormalities in the dog, and also coagulation abnormalities because of the blood loss. So biochemistry analysis also become very important when it comes to diagnostic of CPV. Real-time PCR also plays a very important role because it can detect the virus precisely, as well as serological tests such as ELISA test or CPV antigen test, or in situ hybridization of CPV2 antigens also can be performed to do the correct diagnosis of the CPV virus. Before doing the serological test, since we are taking the serum of the blood or the blood, we can also do some kind of electron microscopy before all the other in situ tests or in vitro tests that we are going to perform. That also can confirm the presence of CPV in the sample coming from the patient. So overall, when you combine the pathogenesis versus diagnosis, as we see that starting from the day one, when the dog is initially got exposed to the virus, after day 2 or from day 3, you can say the shedding will start from the feces, and it can begin from there. And from day 3 to day 5, there will be, a lot of problems in the intestinal as well. Like, for example, you will see the blood diarrhea, like the stool or the feces will have bloodshed inside, or a lot of mucosal or watery diarrhea coming out. From day 4 to day 10, it's the time when you will see the maximum clinical signs. For example, all the clinical signs that we discussed before. And then during that time, doing the diagnostic through ELISA, for example, or through real-time PCR would be a preferable time to perform the ELISA test. Other than that, from day 6 to day 10, there will be also a chance that the ELISA test or other serological tests are giving you false negative results. Is because the shedding will start declining after day 6. And until from day 10 to day 12, the virus is really recovered from the feces. So that's the issue that once you are deciding on the diagnostics, it's very important since the shedding already has started after day 3. So from day 3 to day 10 is the right time when you can actually correctly diagnose parvovirus from the patient. So talking about the diagnosis that we have developed at Bioguard, we are working with a lot of other different kind of tests that are there in the market. For example, our canine parvovirus AG test that can detect canine parvovirus precisely because it's an antigen test. We offer these tests as a single in 2-in-1 combo as well as in 3-in-1 combo as a gastrointestinal panel. Yeah, this is one of the serological tests, or you can say the immunotest that we can perform. Other than when we talk about the genetic testing, we also have developed PCR detection kits that are particularly focusing on canine parvovirus, as well as in a panel of canine gastrointestinal that will have other combination with other pathogens as well. Which also can correctly diagnose parvovirus infection in the dogs. The basic, or you can see the advantage of using a QMINI real-time PCR system is that compared to the conventional PCR, all the reagents and even the PCR programs are pre-calibrated and produced inside the machine as well as inside the kits. So which makes it easier for the vet to perform these tests in the clinic at itself. Yeah, you don't need to be dependent on sending the samples to the reference labs, as well as you don't need any preparations for doing the PCR test. So everything is pre-prepared and the results are reliable because of the reproducibility that we are providing through our continuous research. So when we talk about the biochemistry test, then our minicam play a very important role because as I told you that in parvovirus diagnostics, coagulation as well as basic chemistry analysis, basically particularly talking about the electrolyte is very important. So minicam offer here both the combination of coagulation as well as chemistry testing in just one device. So which makes it very easier for the vet to get the results quickly, reliable, and faster, just in his own clinic. So you can see here the panel combination for the coagulation test as well as the electrolyte test. Also, other health checkup and general chemistry panels as well. So, yeah. So this is all about the diagnostics, and I think we are doing very well in working on the correct diagnosis of these kind of pathogenic or very common pathogenic diseases prevalent inside our environment, especially for dogs and the cats. So when it comes to the treatment, of course, once the parvovirus is correctly diagnosed, mostly the treatment is given according to the symptoms. So sometimes the symptoms are very severe, sometimes the symptoms are very acute or minor. So based on that, or the time of the diagnosis, what stage the dog has been diagnosed. So there is no any particular cure that you can, follow. However, the fluid or the electrolyte is, or the IVs is one of the first treatment that is given to the dog to first of all to regain his the body, his energy because of the loss of lot of blood fluid or the bloodstream from the body. Other than that, antibiotics are another way to give a support treatment to the body. As for the parvovirus, antibiotics are not working. Otherwise, it can support to prevent other infections coming inside the body. Other than that, the vets can also start to have anti-sickness medication and pain medications as well. Depends on the severity of the symptoms that the patient or the dog is facing at that particular time. And last but not the least, the blood transfusion is also very important, because sometimes there's a lot of blood loss because of the damage happening inside the intestines. So the immediate blood transfusion is also very important for the dog for its survival. So basically, the supportive therapies also play a very important role for the CPV treatment. For example, feeding, cleaning, or keeping the hygienic everything, and also the warmth. As you know that the loss of fluid may cause dog to have a poor circulation and make him feel more cold. So that's why to maintain the body temperature is also very important for the treatment of CPV as a supportive therapy. The feeding is also very important, as you know that all the energy or the regain of the body will be happening through the nutrients. So maybe the dog doesn't want to eat at that particular moment, but we have to make sure that we are giving him a proper nutritious feed, so that the dog can regain his abilities as soon as possible. And last but not the least, due to continuous diarrhea or the diarrheal things or the spills happening because of the loose feces, cleaning is very important to control the spread of the virus into the environment, as well as to the other pets in the house or in the shelter areas. So that's why keeping hygienic conditions around the patient is also very much needed during the CPV treatment course. So yeah, if the dog is left untreated, the mortality rate is really very high, which goes to 90%. However, it's also seen that even the dog is getting treatment, the post-infection effects are very much visible in the dog, such as because the virus is causing a lot of damage, particularly in the digestive system, by destroying the anatomy of the small intestines, which makes it hard for absorbing the nutrients from the food, and also for the dog to get okay in a short duration. So that's why the post-infection effects goes for a very long time. And also it can also affect kidney or liver, causing a damage to the immune system, or it can make dog immunocompromised as well for the other diseases as well. So yeah, CPV sometimes can play a very effective role even after the infection is eradicated from the body of the patient or the body of the dog. So yeah, there are vaccinations available in the market, especially for the newly borns. The vaccination can be, core vaccination or the combination of the vaccinations, usually administrated into the puppies after 6 weeks of the age, and the duration of the vaccination is 3 to 4 weeks, continuously to be given until 16 weeks, when the age comes to 16 weeks. And then after that, the booster vaccination is recommended for just 1 year until the dog is of the age of 3 years. However, in the adult dogs, you can actually check the blood, the titer test, to do the titer test to check the presence of antibodies in the blood. And if it's the rate of antibodies, if it's enough, then the boost dose is not needed in the adults. So yeah, vaccination can prevent the infection in dogs. However, there is some chance still that the dog will get effects, basically for the immunocompromised dogs. Yeah. So yeah, this is all about the canine parvovirus. I hope that you get a lot of insights of the infection of canine parvovirus. And let's now talk about Giardia. So now Giardia infection is also one of the most common infections that has been seen, not only in the dogs, but other animals as well. which makes Giardia as a zoonotical disease because it also affects humans as well. So yeah, so pet owners are also very much exposed to Giardia infections as well. However, when we talk about the Giardia, there are a lot of subclasses as well as types that are there in the environment, basically affecting different Giardia are affecting different animals. When we talk about, particularly for the dog, we are talking about Giardia duodenales, is also known as Giardia intestinalis as well as Giardia lambia. So yeah, this Giardia has also three names, and yeah, Giardiasis is a zoonotical diseases. So yeah, be aware of that. If your dog is getting diagnosed with Giardia, yeah, you need to be take care of yourself as well, and of course your family members. So Giardia basically is a protozoa and also a protozoa parasite that resides inside the intestines while it's causing infection there. And when we talk about the presence of Giardia, it can be in two forms in the body. One form is adult protozoa form, where it can be seen as a single protozoa going around the body in the blood or the feet. When it's talk about the feces, it can be present as a cyst, where there is a cluster of Giardia cells or the eggs. You can say basically the immature Giardia, yeah, exists in a form of a cyst. Can be seen in the feces basically. So yeah, to understand the Giardia into more details, we have to first understand the life cycle of Giardia. So as you see that Giardia also can enter in the dog through the oral cavity. Basically, when something indigestible is happening, when the dog eats some kind of a contaminated food, or it can by mistake try to eat the feces of the infected dog. So when it ingests these kind of things, and also it can be water or other substances from the environment that are holding the cyst of Giardia. And when it enters into the gut area of the dog, in the intestines, it get to start replicated and to make more Giardia cells in the small intestine. And this multiplication always happen inside the host, where Giardia is actually using host nutrition to getting replicated. And once this replication is happening, the Giardia oocytes or the eggs, can form the cyst and then get shed from the body as into the feces, where it can also affect other animals such as cats. You can say because other pet animals are mostly the cats, as well as humans as well. So yeah, the prevalence of Giardia is that's why very common in the environment because of the life cycle that it is doing, and as well as the survival rate is very high in the environment. So particularly when we talk about the dogs, the risk factor are basically have seen mostly in the young dogs getting infected very easily, and usually in those dogs where the clinical side get too worse, and also the weather conditions also push this kind of infection a lot, mostly during the wet and the cold temperatures, because it is favorable for the survival of the cyst in the environment. Overall prevalence in the dogs is 1 to 7%. However, because in the pet dogs, it's less prone or exposed to the bad environment or the contaminated environment, you can say. However, the shelter, in the dogs living in the shelter, like from 50% to 70% can be the case that they will get infected by Giardia. So once, the Giardia has entered into the dog, it can cause some kind of clinical signs. First of all, of course, there will be an onset of sudden diarrhea, which can be having some kind of a foul smell that it can be detected by the pet owner. Other than that, there can be a chronic diarrhea as well, chronic to intermediate way, where there will be a fatty stool, or the stool can be of different types, such as it can be soft or watery, it can be greenish in color, or also it can be occasionally having blood stains or reddish color as well. It can be having an excessive mucus as well. So all these signs, when you are seeing in the stool, basically in the diarrhea stage, you can also assume that the dog may be affected by the Giardia at that time. Other symptoms combined with the diarrhea can be of vomiting, as well as fever or the weight loss. So the weight loss is, of course, one of the very precise symptom have been seen in the dog, because many dogs are actually asymptomatic, which are carrying the Giardia. However, they will not show you any sign of illness. However, by the course of time, you will see a lot of weight loss is happening in the dog. And especially the younger dogs exhibit a lot of clinical signs because it's more prone or immunocompromised at that stage. So after understanding the clinical signs as well as the life cycle of the Giardia, it's very important to have correct diagnosis, because Giardia diagnostic is also not very easy for the vets because of the the common kind of diarrhea is happening, and also because of the the morphology of the cyst that is there in the feces. So first of all, of course, the diagnostics start with examining the stool sample or the fecal sample to see the presence of cyst inside the feces, or the most important can be to test the antigens for the Giardia, particularly some kind of proteins that are, basically belongs to Giardia. So the cyst can be seen under microscopy doing a proper kind of staining. There is a protocol that vets are following to have the proper staining of the Giardia. Actually, the size of the cyst is only 10 nanometer. So that's why 10 millimeter. So that's why it's very it's okay to see under the microscope. However, compared to the other cysts, probably which are also there in the feces, we have to know what kind of cyst is of Giardia, because it's actually a very small size compared to the other cysts present probably present inside the feces. Or the shedding of the cyst is not yet happening. There's already an infection. However, the cyst you cannot see in the feces, so you need to actually do the multiple testing again and again for the microscopy to actually detect the cyst, Giardia cyst inside the feces. Yeah. And when we talk about the Giardia specific antigen testing, of course, ELISA testing, as well as the sandwich lateral flow immunochromatographic assay is also play a very important role. For example, we have developed a Giardia antigen test that can detect a Giardia precisely in the feces during the course of infection. And this kit is actually detecting both canine and feline Giardia, which makes it very unique product into the market. Other than that, as we see that the cyst, the structure of the cyst actually having the cells inside that has nucleus also. So the real-time PCR can also play a very important role in the detection of Giardia, so as that through our products such as Qmini real-time PCR analyzer, provide you that kind of flexibility of detecting Giardia through PCR detection as well. You can see the combination of canine gastrointestinal panel as well as canine feline, single panel, where you can detect Giardia and as well as gastrointestinal pathogens directly through a real-time PCR. So you can see both the techniques that we are providing through our products will give you a surety of the presence of the infection of Giardia in the dog. So yeah, after there is a correct diagnostics, yeah, there will be a treatment that we have to start to giving to the dog. So there is a very simple treatment that is given to the dog. Mostly vets are using metro uh, uh, metronidazole at the dosage of 10 to 25 mg per kg weight of the dog for 12 hours, each 12 hours from 5 to 8 days based on the improvement of the symptoms. However, there's another drug which is fenbendazole, is also given or chosen by the vets to be given to the patient at the dosage rate or rate of 50 mg per kg of the weight for 24 hours each day from 3 to 5 days or to the dog. And also in some severe cases, we can also choose to have a combination of both the drugs together at this particular dosage and also for different time duration because fenbendazole is given only once a day. However, metronidazole can be given twice a day for the course of 5 days together. Other than that, and since in gastrointestinal infections, the diet plays a very important role because excess of dehydration as well as loss of absorption, capability of the dog makes it very vulnerable at that stage. So that's why having a good diet at that time is very important for the patient to be get recovered from the infection. Also, we have seen that bathing is very important because you can see that this is one of the very different kind of part of the treatment because we have seen that once the shedding is happening, the cyst which is there in the feces can survive in the environment or also can stick to the hairs or the body parts of the dog, which is not very easy to eradicate, because it will survive easily. So that's why bathing or the cleaning of the patient itself is also very important to get rid of the Giardia cyst from their hairs or the body parts. So yeah. So after that, the prevention is also plays a very important role for controlling the infection of Giardia. As you see that the treatment of Giardia is very simple. However, the infection rate is very high because it doesn't matter the dog is indoor as well as in shelters. The dog can easily get infected by Giardia through the environment and also makes it very prone for the family members that the dog comes in contact with. So since the prevention is also plays a very important role to control the outbreaks of Giardia, especially we have seen that Giardia environmentally can be through waterborne transmissions and as well as mostly infections are seen to happen through poor sanitization condition. So therefore, mostly prevention can be done by improving the hygienic conditions around the patient or the previous infected dogs, as well as prior, or also to control the prior infection like upcoming infection or Giardia for humans as well as for the pets in the house as well as in the shelters. So yeah, both of the diseases that we discussed today, canine parvovirus as well as Giardia, are actually one of the mostly commonly seen diseases that are there in the environment. However, it's also very easy to get treated, yeah, if the treatment is given at the right time. So yeah, thank you so much for your attention and being there to be with us during this lecture. And if you have any questions, you are most welcome to type in the chat box, and we will try to address these, or we can also get back to you later. Yeah. And also the people or the participants who are there for at least 45 to 50 minutes will receive a certificate from us later on. So yeah, if you haven't registered and just directly join the webinar today, please leave your email address as well in the comment section so that we can get back to you with the certificate. Yeah. So yeah, we are most welcome to ask questions. So yeah, there is a question coming from a attendee. He is asking like how many times we can bathe the dog who is infected with Giardia. Like, you know that bathing is different for the dogs as well as for if you talk about the cats. Usually the cats are not very happy for having to bathe them occasionally. However, for the dog, I think daily bathing is also not okay for their fur or for their hairs as well. But seeing the severity of the cases, if the diarrhea is very often, I think the cleanliness of the environment as well as the body is okay. However, bathing you can do after 4 days or 5 days, during that time. Okay. So we also got a request that people, some of the participants would like to have the PPT as a, yeah, so we can share with you later. Yeah, so no problem with that. No. So I can see some of the emails people have shared with us. Yeah. So I hope that you have enjoyed today's lecture as well as the information that we try to share with you today. So thank you so much for joining us today, and we hope that we can provide you with more informative, content in future. And at Bioguard, yeah, we are very much dedicated to work directly with our users as well as to share the information of our developments or the research that we are doing at Bioguard and also in our R&D labs. So thank you for being with us, and please, we request you to follow us on Facebook and LinkedIn because we are having a continuous development and the information there that is very useful probably to all of you. Okay, we have a question from okay, can you please tell us about diarrhea due to salmonella also? Okay, so I think salmonella is another topic that we would like to cover because just talking few sentences would not be fair to know the basis of the disease as well as for the diagnostics and the treatment as well. So we will surely cover this topic in our upcoming webinar, but we really appreciate. Thank you so much for sharing your feedback about that. Yeah.
Okay, thank you very much. And thank you, Dr. Susan, for the excellent presentation. We'll see you again next month. Good
Yeah.
night.
Good night, everybody. Thank you. Bye-bye.